Once the diagnosis is made that there may be some hip instability, we'll refer the patient on for an ultrasound of the hip. That's the superior imaging study in the first 3 months. And after 3 months, the x-ray becomes the better way to follow it because the bones have ossified a bit further. Initially, they're cartilage, and that's hard to see on the x-ray. So if there is an instability, we will treat at that visit with a pelvic harness. And that's a cloth brace that's been devised in Europe many years ago. Very effective in treating hip problems in childhood, has about 90 to 100% success rate to treat them. So for the 0 to 18-month-old infant child that we see, bracing is by far the most common way to treat it. If we see the child a bit later or there's a bit more difficult to manage by bracing, we may have to take the child to the operating room and reduce the hip dislocation, and with imaging studies available in the operating room, and then cast the child in a special cast that goes above the waist for up to 3 to 4 months for the hip to stabilize during that time. The one thing about the hip condition in a newborn period is that there's a lot of estrogen still on board from the mother, and the exam will change from week to week, so there's tremendous potential for the hip to stabilize early on with the brace treatment.